Welcome to the Incident Command System Basics for KPHD staff. In this training, you'll be learning about why and how we'll be using the Incident Command System when there's a community disaster or emergency. The Incident Command System is a way for us to organize staff and resources when we're hit by something bigger than usual. The Incident Command System, or ICS as it's commonly known, is a way for us to organize quickly, efficiently, and effectively. At the end of this training, you'll be able to describe at least 3 advantages to using the Incident Command System in any emergency. You'll be able to describe 8 roles within the Incident Command System structure. And you'll be able to explain how you could use the Incident Command System in a big event involving many people or in a small event with only one person. The Incident Command System was first used in the 1980s when California wildfire fighters needed to organize themselves quickly and effectively at a moment's notice. Since then, the Incident Command System has been adopted by law enforcement, emergency fire and medical services, and other emergency services. It's a simple, standard way to organize first responders. First responders are the individuals who jump into the fray when emergencies hit. Sometimes we, public health, get to join the first responder group and jump in too. When we join with the other first responders, the Incident Command System provides us all with the framework for how our agency will respond to an event and for how we will coordinate with other agencies in our response. The purpose of this training is to introduce you to the Incident Command System structure so you'll know when we're first responders how we'll be organizing ourselves and working. You may already be familiar with the Incident Command System. If so, consider this a review. If this is all new to you, please note that at the end of this training you'll see a list of resources if you have questions. What's so special about the Incident Command System? ICS sets up a chain of command that makes it clear who reports to who. It uses a common vocabulary so everyone is on the same page. This helps local, state, and federal community partners better understand each other because they all use the same terms when they're in incident command mode. ICS framework limits the number of people one person could be expected to supervise. The most would be 7 workers per supervisor, but the recommended is 3 to 5 workers to 1 supervisor. The system is flexible. You can use it to organize people at a roadside accident, a house fire, a mass vaccination clinic, or after an earthquake. You've probably used it already and didn't even know it. The system has designated roles and jobs for responders so they know what to do to get the resources they need to get the job done. So here's the basic organization chart for the Incident Command System roles and responsibilities. We're using dogs to represent the various positions to make it easier to understand and remember the roles. Think of it as a pack of first responders moving together to respond to an emergency. There's the incident commander. He or she is the boss, the leader, so to speak, of the pack. Then there's the Public Information Officer, or PIO. That's the media person, the show dog, that puts together the important messages to tell the media and the public about what's going on and what we're doing about it. The liaison comes next, and this person is the link with the other agencies that are also responding to the event. The safety officer makes sure that members of the command pack are safe and are performing safely. These 4 make up the basic command leadership for the pack. The Public Information Officer, Liaison, and Safety Officer report directly to the Incident Commander. The next level in the pack is made up of the command sections, and each section is led by a chief who also reports directly to the Incident Commander. Logistics are the getters. They retrieve equipment or materials that people involved in the response need, and they deliver it to them. Operations are the doers, providing direct help to victims or services to help the community remain healthy. They may be at the site of the disaster or at another location like a shelter or at a site for mass vaccination dispensing. Planning are the thinkers, thinking ahead and asking, what if? They recommend next actions and responses. They also keep track of what's happening with the event. And finally, the admin finance section. They're the payers who work to make sure there's money to pay for people and whatever else is needed to deal with the event. They track the staff time and costs. There are more levels. They're called branches and divisions, but it's unlikely we would be needing or using those levels. So to recap the incident command roles, see if you can match the correct command system role description with the right dog before the name appears by the dog on the screen. You are totally in charge of everything. You are thinking ahead, figuring out what to be prepared for. You're obsessed with everyone's safety. You talk to the media and get information out. You pay the bills and make sure all time worked is accounted for. You keep in touch with other agencies. You're in the field responding to the event. You get the stuff people need to get the job done. Now that you have an idea of how ICS is structured, let's take a look at how it works at the Health District and in Kitsap County. If we have a big emergency or disaster, most likely our Emergency Coordination Center, or ECC, will be activated and will organize using the Incident Command System structure you just learned about. That means that staff who are managers and who have been pre-trained to be part of the command staff will report to the Sinclair room where the ECC will be set up. The Incident Command System organizational structure will be initiated. If you're field staff or office staff, you may be called upon to assist in one of the sections in the area where your abilities are most applicable or where you're most needed. For example, when we held the H1N1 vaccination clinic in 2009, we were in ICS mode. The nurses doing the vaccinations were in the operations center. EH staff helped with getting supplies and traffic control, so we're part of the logistics section. Support staff and others helped customers get their paperwork together and ready for the vaccinators, and so we're also part of logistics. Some staff assessed how the process was going and advised changes as needed. They were the planning section. They shared their advice with the planning chief, who relayed it to the incident commander, who then directed the logistics chief to make the changes. That's how the ICS chain of command works. Meanwhile, the admin finance section made sure that everyone's time was recorded and coded to the correct account so the bills could be paid. For a community-wide disaster, the County Emergency Operations Center, or EOC, located at the County Department of Emergency Management, will be activated and will also be organized using the ICS structure. Our liaison and PIO positions will report to the EOC. Suzanne and Keith are the two pre-designated liaisons, and Chris Craig is the primary PIO, with backup from Leslie and Scott D. If the disaster involves public health issues like a disease outbreak or water contamination, Dr. Scott may report to the EOC and advise the command team, and one of the managers might be called upon to go to the EOC to be part of the planning section there. The other aspect of the incident command system that it's important to remember is that it is strong enough to be the standard for response agencies across the country, and it is flexible enough to be used by just one person. Imagine this situation. You are home alone cooking dinner for guests. You are setting up and preparing the food to be cooked. Then you put out the fire. Now you figure out what to do since the fire changed your plans. You let people know what's happening. You tell the fire department. You get the supplies you need. You protect yourself and others. You figure out what it all costs. You've just performed one-person ICS. You took responsibility for dealing with the fire and became the incident commander. You kept yourself and others safe from the fire. You were the safety officer. You worked with the fire department. You were the liaison officer. You shared information with the public. You were the PIO. You put out the fire and cleaned up. You were the operations section. You got the fire extinguisher and mop. You were the logistics section. You chose a new dinner and told your guests. You were the planning section. You paid for takeout and figured out what the whole incident cost you. You were the admin finance section. So in a disaster or emergency, you may fill all, some, or one of these roles. That's ICS in a nutshell. Now you should have a basic understanding of the incident command system structure and the 8 roles that health district staff may be filling. When we're first responders, you'll know how we'll be organizing ourselves and working. Remember, you can use ICS in any emergency because it's flexible, responders speak a common language, and there's a chain of command, so everyone knows who's in charge and who to report to who. If you want to know more about ICS, here are some websites. Also, this training will be on the ANET whenever you want a refresher. And if you have any questions about any of this, the incident command system, your role in a response, how the health district would respond, call us. Remember, when we're first responders, ICS is best.